And welcome back. We're moving into our final segment for today, and we're going to be focusing squarely on brain tumor awareness. And joining us for this conversation, we have Dr. Ramon Yacab. Good morning.
Good morning.
Welcome.
Good morning. Thank you. This morning, well, the main topic today is brain tumor awareness. Now, why brain tumor awareness? We know that we always talk about breast cancer, and yes, October is generally pink. Now, when it comes to brain tumors, it's generally gray May. However, internationally, we do have a week designed specifically for brain tumors, and that was last week. Now, brain tumors are aggressive tumors, and sometimes we don't hear them being mentioned too much. They're not really that frequent. If we take out 100 persons, brain tumors would be around roughly about 1 or 2 persons, primary brain tumors. But the fact is that around 40% of all the patients with any type of cancers could develop brain tumors in the form of metastases. So it is, if we talk about brain tumors on a whole, it tends to become a large problem when it comes to oncologic patients.
Okay.
Now,
he used a lot of words there.
I know.
Completely went past my brain, you know. First of all, you are an oncologist.
Yes.
What does that mean?
That implies that I'm a specialist trained specifically in helping diagnose cancer, treating cancer in the forms of chemotherapy, hormone therapy, or targeted therapy, and also helping patients in terms of palliative care. So
Now, going back to therapy, because most people are aware of chemotherapy,
yes,
but homotherapy and the other one that you said?
immunotherapy.
Immunotherapy. Let's talk a little bit about those as options.
As options, yes. Hormone therapy is generally, as some tumors, for example, if we talk about breast cancer, I'll tell most of my patients, most of the type of breast cancers like to depend on hormones in order to grow. So what we do is generally block hormones. So that's where hormone therapy comes in. And most of them are oral pills. We use it for prostate cancer too in the form of injections to block testosterone. Now, immune therapy, that's like the new type of treatment that we're garnering throughout the past 5 to 10 years, whereby we stimulate our immune systems to fight against cancer.
Interesting.
Now, how does all of this tie into brain tumors? Because immediately when you start talking about cancers, it's a leap from brain tumors, because people don't necessarily understand. What is a tumor, first of all?
A tumor is an abnormal growth of a tissue,
How is that different from cancer?
because the tumor could be both benign or malignant depending on the characteristics. A cancer is a malignant tumor that has an aggressive behavior. The only sure way we could know is evaluating through the microscope the characteristics. And when it
And
comes,
benign and malignant just means their ability to reproduce? Or?
yeah, it means their aggressiveness. For example, we know that good benign tumors have a good prognosis. If they're resected, there's no chance of recurrence. It's not coming back
If you cut it out.
if you cut it out.
You guys are going over my head. You're using a lot of big words, and
I'm sorry.
it's completely regressive. What?
Yeah,
Could you break it down for us so that we
well,
can understand?
no
Even
problem.
if it loses a bit of its accuracy in terms of science, can
Okay.
you just break it down so that we?
Okay. Benign tumors are, for example, if we took any lump in the skin, we take it out and that's it. We don't worry about that.
It's not going to grow
it's
back.
It's not going to grow back. Now, a malignant tumor, apart from growing in one specific organ, has the potential to spread and go to other areas of the body.
Interesting.
That's what makes the difference here. Now, it's interesting that most brain tumors, even though they do have a malignant potential or cancer, they tend to stay within the brain. And that's where most of the symptoms come from the brain affection.
Is the brain more susceptible than any other part of the body to tumors?
The tumors, it's less, I'd say.
Oh.
It's less.
Why is that?
Why? Because the brain is really protected by membranes. So most of these tumors have a difficulty time reaching the brain. So when they do reach the brain, we do know that it's a very aggressive tumor. And tumors that develop within the brain generally don't go out from there. They stay there.
It's a dangerous place to be, though. It's a very dangerous place
It
to
is
be.
a dangerous place to be. And why? Because the brain is such an important organ, and it's a complex network. If we are depending on the area that's being affected, and even depending on tumor size and tumor growth, the symptoms can develop. And most of the malignant, and I say malignant tumors here, have a very aggressive component in terms of general survival.
And what are the symptoms that would actually trigger you to go? Because most people are not going to go in and say, can I check for a brain tumor, you know?
Yeah.
So
most of the time, patients have unspecific symptoms, and it develops the area that's being affected, but it could involve dizziness, persistent headaches, it could nausea, vomiting, double vision. So most of them, and seizures, very important. Up to 80% of patients that do manifest with a brain tumor could have seizures.
And can you talk to us about causes? What is it? How do I get a tumor? And how do I, more importantly, not get a tumor?
Now, it's really difficult to define causes, as I mentioned. When we talk about the tumors that arise just in the brain, we don't have a cause. We know there are potential risks associated. Actually, it's important to know that we always try to link up the genetics of a person in terms of the risk of developing cancer. When it comes to brain tumors, it's really low. There's no genetic risk, for it just develops sporadically. The only factor that we know up to date is associated with brain cancer is radiation. That's the only specific factor. Now, other tumors, for example, breast cancer, can it go to the brain? Yes, it can. And that's, I would say it's more frequent than a tumor arising just in the brain.
Can you give us some examples of radiation? Because you say that is one of the huge culprits.
Yeah, it's mostly in the hospital setting. For example,
Cell phones?
patients, talking about cell phones.
I know you were going to go.
About cell phones, it's been linked. It's controversial. We don't have any conclusive evidence that cell phones could cause brain tumors. However, it's controversial because there are links that say that cell phones increase the risk slightly. Actually, WHO and the International Agency for the Research on Cancer has changed the category for cell phone use, or as they may call it, electromagnetic field usage, as a possible cause of cancer to a probable cause of cancer. And we still need more data. But there is definitely a linkage there when it comes to cell phone use.
Two other things on one of the previous slides that we had. You talk about speech issues.
Yes.
How can that be a signal?
Slurred speech could be one. It depends. We know that the brain, as important as it is, has areas that actually help control the speech, other areas that help control body movements. So any changes in speech, not only speech, memory loss, changing behaviors, should put out red flags and say something is not good here. And maybe it not maybe a tumor, but that should be alerting signs that tells get checked.
And could it be attributed to, like, some people just aging?
Well, we could talk about dementia, but generally dementia has other symptoms that do not involve, how could I say this, focal alterations, meaning it's not really associated with seizures, it's not really associated with blurred vision, it's not associated with double vision.
So it's a combination you're looking for?
Yes, it's a combination of signs and symptoms. And as I mentioned, most of this are not specific because it could be given by other type of diseases, for example, strokes. Mm-hmm. So the thing is, if you have the symptoms, get checked. Get checked.
I appreciate these segments that we do and seeing the young doctors coming in. I know there are a lot of veteran doctors coming in, but it's refreshing to see the future of the medical profession in Belize being represented by you guys. I wanted to go back to the culprit, which is exposure to radiation. And I know that one of the things on the slide was chemical exposure to radiation. Could you widen that a little bit more for us?
It's mostly when we talk about exposure to radiation, it's generally patients who've had a history, that could be one, of cancer and got radiation in the form of the treatment part. We know that there are exposition to radiation through x-rays, through CAT scans, and even though there's no conclusive linkage that says doing a CAT scan increases the risk, the potential is there.
But how do you detect a brain tumor?
Through CAT scan, yes.
Man, it's not wickedness.
Yes, I know. It's really a complex area.
Do you know the incidence of brain tumors in Belize?
In Belize, we don't have a registering system. That's the main issue. However, we do have projections. Now, according to WHO and according to GlobalCan, that's an international reference we use, in Belize, it's estimated that there's around 3 cases of primary brain tumors per year. 3 cases. And actually, the 3 cases that are diagnosed is equivalent to the 3 cases of deaths associated with brain tumors. So mortality in a country like Belize is quite high. Not
It's
only
100%.
it's practically 100% because most
Give us
of
some
the
good news,
cancer-
man.
Well, what could I say?
We have a Brain Tumor Awareness Society, right?
Yes, we have a Brain Tumor Awareness Society, and that's where we come in. It's a group of clinicians, health professionals, and non-health professionals aligned to try and raise awareness and trying to get the red flags.
And we have a president who...
Yes, Miss Nunez, Miss
survived.
Kalia, yes. She's a survivor from an aneurysm, and that boosted her to try and get the organization going, and she actually contacted each and every one of us.
Yeah.
And-
Can you tell us, I know we're fast running out of time, but treatment. How if I'm diagnosed as having a brain tumor?
Okay. Now, if you're diagnosed with a brain tumor, if it's possible, surgery. What we plan to is surgery.
Do you have the capacity in Belize?
They have neurosurgeons. Some do have experience removing, but it all depends on tumor location. If it's superficial, they have the capacity to do that. But if it's in an area where there could be too much complications, then they can't. Not only that, but treatment nowadays is not only surgery, because the chance of tumor coming back is a little bit high. So what's done is the patient has to undergo radiation and chemotherapy at the same time.
Before surgery or
After surgery.
after?
After surgery.
Wow.
After surgery.
Now, what would you, because the incidents are so low, people may not pay attention to it. Frequency brings it more to mind. Why have this conversation with people about brain tumors and the importance of being aware?
Because I think it's important to raise the issue, because unlike other tumors, this one is really aggressive. So if we could have an opportune time to detect it, we have a chance of improving the patient's survival. And that's the reason why. Not only that, but if we talk about the other diseases where tumors go to the brain as a metastases, there are treatments that could help. Maybe we cannot offer a cure, but we could certainly help control the patient's symptoms and improve quality of life. So nowadays, it's not the same thing diagnosing a cancer and stating, well, prognosis will always be poor. It's not like that. We have to try and improve quality of life.
My final question is, Brain Tumor Awareness Week is October 22nd to 29th.
Yes.
And as William was saying, there's a small incidence of it. What does the organization wish to achieve during this week? What will be happening during this week, and what will you mark as a success during this?
Okay, well, it's the first year we're doing this. So for us, a success is trying to deliver the message. It's getting the message across. That's for a start. We could see medium and long-term aims, but for this moment, it's trying to get the message across and trying to let persons that they're not alone in this. There's a society that could help. And then the society, Brain Awareness Society, it doesn't only try to raise awareness, but it's actually trying to help the patients diagnosed with a cancer who we know undergo other medical conditions, including depression, the organization helps.
Support system.
Yes, they have an adequate, the organization has an adequate support system. And I think that's the message we want to deliver.
So how can people get in touch?
In touch, actually, the society has a page on Facebook. It's Belize Brain Awareness Society. For anyone who wants to try and contact us, I think it would be through our Facebook page. And we're actually accepting members and pledges.
All right. Well, thank you very much for joining us this morning. And thanks for increasing our knowledge and definitely bringing awareness to brain tumors and just brain wellness, I guess.
Thank you, and thank you for the invitation.
We're going to go ahead and take our break, and when we come back, it'll be for a wrap. Don't go anywhere. Open Your Eyes concludes after these messages.